good morning, everyone.
Good morning, Mildred.
Morning.
Morning, Mildred.
Morning.
Good morning, everyone.
All right, today we'll jump right in and we're going to look at another case that will help us go through the system. We'll look at the central medical stores and the pharmacy module of the system. I will get a case that will be better for us to go through. But before that, let's review what we have done. Yeah?
I have a question. Yesterday,
Okay. All right.
I tried doing a practice, of a case, and I was successful. But somewhere along, I realized that the unique ID, as the unique ID, I placed the passport number. But later on, I wanted that changed to the person's code, and I could not do it.
Yes. Yeah, that's the functionality for the administration rule. So with screens and management, you can't do that. The administrator can do that.
Okay.
Yeah. So for an administrator, when the super user or the supervisor or whoever is the administrator of the system logs in, they can come under supervision, users on account, and update clients' personal information. Now, what was the unique ID? You have it?
Mildred, it is where did I write it down? Where did I write it down? Oh, it's on the code. It's RA020941.
Okay. So we get that ID, and you can come to, so the supervisor can come to unique ID, and you want to change that to the testing code?
Yes, to her testing code.
Okay. So these are testing code.
Right.
So I'll come to unique ID, and I will do this.
Okay.
Update. So now we can use the testing code.
Okay.
So if I try to enter the new unique ID now, I'll get the same record back, and you'll see the unique ID is changed.
Okay. So all the information that I've placed in, I will be able to retrieve it using that her code.
Yes, you can now use the code as the unique ID.
Okay then. All right.
Okay.
Could you explain that again, Mildred, please?
Okay, so a user that is assigned the administration role, and all of you here are assigned screenings and management, is able to change, update security information, things like the names of the client, the unique ID, the country of birth, the ethnicity, can only be changed by the supervisor. So if you have an error in entry or you want a change, whoever the supervisor is or who the administrator of the system is the only person that can update those values of a client. And so that person will log in and update client's personal information, and then we'll be able to update that.
Okay, thank you. I have a question, Mildred.
Yes.
What if the supervisor cannot be found
now? You have to leave. Somebody will be acting, or somebody will definitely be there at some point. Okay. So those kind of problems, administrative issues where there is no supervisor or nobody knows who manages the system, are not supposed to be the norm. You're supposed to know who within the HIV unit manages the system, and that's why we advise that the super user functionality resides within the HIV office or the HIV secretariat or whatever is named in the country. Except if that unit is closed, there has to be somebody there who knows about the system and how to manage it.
Okay, thank you.
Yeah. We want to use a scenario of about Bruno. And this scenario is on the manual. The manual is in your resources. I'll get you the page of Bruno. So on page 188 of the manual, we have a case, Bruno. I will get the manual and go to page 188. Let me see. Okay, yes, we are looking at Bruno's case. So Bruno is a 42-year-old Caucasian male presenting at the health center with reports of several weeks of generalized weakness, nausea, headache, clay-colored stool, and joint stiffness. He has never left or resided anywhere elsewhere. He is single, unemployed, has sex with men only, and never uses condom. He uses injection drugs and has had over 10 sexual and injection drug partners in the last year. He received a transfusion of blood 2 years ago. He has no existing medical conditions. He was incarcerated about 3 years ago, was homeless after release, and has sex in exchange for food and drugs. So we want to create an account for Bruno, and we want to use this screening information for the screenings of Bruno, and also we want to list all of these contacts, the household contacts, the injection and sexual drug partners that he listed, and then we'll refer Bruno and start the clinical management of Bruno. And we have lab results for Bruno and different hospital visit scenarios that we can use. This will help us simulate the other parts of the system, hepatitis treatment and syphilis and other STIs, and how to record them here. Is there anybody who wants to volunteer to share screen and do this with guidance, or I should go ahead?
Go ahead.
All right, I'm going to switch screen. Somebody is writing on the screen. Hold on. All right. So I'll log in as someone with screenings and management role. And I want to first of all assume that Bruno is not on the system. He has never been screened before. And we want to create an account for Bruno. The scenario says that Bruno is 42 years old, which means that he must have been born in 1982. Let me see, 42 years is what year? Yeah, 1982. Okay. So we'll create the account today. And I'll just use anything for contact. Facility type, let's say this is testing and counseling site. The name is Bruno. And his middle name is unknown. His last name is unknown. Let's just use 1st of January 1982. Then he's a male, and mother's maiden name is also unknown. Testing code is generated, and we want to have a unique ID. This unique ID type is other. Now I want to request release. And then we collect information. Does everybody understand up until this point?
So far, so good.
Okay. So once you create an account for a new client, you request release of the file. The file is released until 11:59 p.m. of the same day. Once the clock changes, the file is withdrawn. You have to request release again. This way, the system logs everybody who accessed a particular client's record. The collect client information link will help you to now enter that unique ID to get the whole file of the client. On this file, there are different definitions that are used. You get directions on the different things to do, and you can see the basic summary that was entered when the account was created. We have links or shortcuts for you to start risk reduction if the person screening just maybe it's negative for all the screenings that you would have done, and the risk behavior suggests that the person needs a risk reduction. You can just start the risk reduction here, and it redirects you to the file. There is also a link to go to prevention and control and do exactly the same thing, but this is a shortcut where you don't have to enter the unique ID. It just takes you, opens a file for the person. You can look at all the previous risks to compare if the person is risk behaviors has always been like that, or it's just getting worse, or to see the comparison of all of the risks. That is for clients who have existed on the system for a while. Then you can look at also the risk reduction plan history that was recorded on the system. Below you have the tab pages that has different tabs. If the biological sex of the client is male, you won't find anything about pregnancy tab here or antenatal tab. If the biological sex or the sex assigned at birth is female or intersex, then you'll find tabs to register pregnancy or all those antenatal forms. So we're dealing with a biological male, and so the system doesn't generate any file or tab for pregnancy or pregnancy registrations. The scenario says that he came to the health center with reports of several weeks of weakness, nausea, headache, clay-colored stool, and joint stiffness. So we want to put the date and the date of birth is already there. Let's look at the country of birth. It wasn't given. They just said he's a Caucasian male. So let's say we don't know. The system might reject unknown as country of birth. So let's say I'll just use Dominican. So reporting fields are required, and the system might throw it out or make us fill it again to make sure that we are not skipping this by mistake. And the person resides in the current country of screening, let's say it's Dominica. Then the address, let's say 234 Long Road, and the town is, let's say, LA City. Now the health district or wellness center, you select that, and the parish. The length of time in the country of screening should be equal to his age, because the scenario C has never left the country or resided anywhere else. The gender identity is male. From the scenario, he has sex with men only. So he's going to be homosexual. The telephone number is not required. If you have it or if they give you, you want to add it there. The marital status is single. Ethnicity is Caucasian. The occupation here is unemployed. Highest level of education, we don't know that. The number of sexual partners, he said he has over 10. So we'll say 10 to 20. Type of sexual activity, we'll say anal. The is not applicable. Has the sexual partner been tested for HIV? No. The client is alive. The cause of death is not applicable. And has the client left the country? No. Now we want to collect the risk behaviors. According to this scenario, he uses injection drugs. He has sex with multiple partners. He never uses condom. So we'll know he was incarcerated. He was homeless. He exchanges sex for food and drugs over the years. So fill this in. Had sex with males in the last 12 months, with females never. Had sex with persons of known HIV positive status, never. Had sex with sex workers. Exchanged sex for drugs or material gain in the last 12 months. Shared needles while injecting non-prescription drugs. Crack cocaine or illicit drug use. Had sex under the influence of drug or alcohol. Had sex with multiple partners. Had perinatal exposure to HIV. Received a transfusion of blood. Yes, they said that he received a transfusion of blood 2 years ago, over 12 months ago. Had occupational exposure, never. Have been a victim of sexual assault, we don't know that. Received a transplant, no. Confirmed diagnosis of STI at the time of HIV testing. Confirmed diagnosis of TB. Had contact with confirmed TB. Been previously diagnosed with HIV, and this is for TB patients. Condom use, he said never uses condom. Is the client incarcerated or have a history? Yes, he was incarcerated about 3 years ago. He was homeless. And is the client a sex worker? Never. Has the client had sex with transgender female? Never. So we have the answers to most of the questions from the scenario. Now, comorbidity, we have no history of any illness or any existing medical condition. So we're going to fill no. So diabetes, lymphoma, renal disease, chronic lung disease, high blood pressure, and we don't have. For the medical history, he has nothing, but if he has something that is not part of the list, he can specify under others. So let's say alcoholism, no. Malnutrition, no. Reason for test, to obtain medical care. Has the client been previously tested for HIV, diagnosed with HIV? And has the client been previously diagnosed with STI other than HIV? Has the client been previously diagnosed with TB? Now we want to do the HIV screenings. Now, the screening information given in the scenario, let's look at that, is that he was screened for HIV, syphilis, and viral hepatitis. His results are VDRL reactive, the titer is 1 in 256, TPHA is reactive, HIV rapid is non-reactive, hepatitis B surface antigen is positive, HCV antibody is reactive, HCV RNA is detected, genotype 1 HCV. So he has both hepatitis B and C. And then he listed contacts. So let's work with that. So the HIV screening is non-reactive. Then we have the syphilis screening. VDRL has a titer of 1 in 15256. So let me do that. And then we have TPHA. Test result 1 is reactive, result 2 is positive. It was also screened for hepatitis B and C. I will log out and try to add those screenings as an administrator first. So anything about configuration, whatever controls the options we have on the drop-down menus is controlled by whatever the administrator sets for the options. So when you have different options, checkbox, drop-down menu, and you don't find the option you want to send a message to the administrator to add that to the option list. So I want to add to my screening list, I want to have the kind of screenings we want to do. So see this on the option menu now. Okay, so we now have that on the list. We want to do other screenings. So anything that is not HIV, not TB, not syphilis, you can record under other screenings. So we want to do HCV antibodies. It is reactive. And let's say the test now is HCV RNA. And let's both awaiting results. I want to illustrate what the lab sees and how the lab can update results here. So I'll put awaiting results. So let's say at the time the sample was taken is awaiting result. Then later in the day or another day, someone in the lab processes the result and wants to enter it into the system or sends it back to the health center, and you're about to enter the result into the system. And the client is not there yet or has not been called to come in. You're entering the results just to have the result on the system in the event that the client goes somewhere else. So you log in as someone with the screenings and management role, and then you come here to screenings category mortality update. You click on that and you click on other updates, other or update screenings, and you enter the unique ID that you find on the result. So which means for every lab request, you want to use the same unique ID that the client uses on the system so you can easily update the results. Now you have this screen that only shows you everything about results. Sorry, hold on. Okay, so we have this screen that shows us all the different screenings, and what we want to update is in other screenings. We already have this here, HIV RNA, and is awaiting results. So this is what we want to update. So let's say it's the same day, but we want to now enter the result. What the history gives you is the history of all the entries of so it will tell you when sample was taken and awaiting results, and when the result was now later entered into the system. So we want that for the RNA, and let's say the result is detected. Let's just use positive. Okay, and then the date. So this is how you update results when you are just updating results that you have received, and you don't have to go through release client file, go through the whole file. You only come to one part, which is the update here. Screenings category mortality updates. You have to have the updates permission to be able to do that. So for all the supervisors here, anybody in the lab or anybody that has the screenings and management role should have the updates permission. So once you update that, you can also use this to update the category. If you referred somebody as a pediatric when it's supposed to be adult, you can come here to change the category. And if someone dies before the screening results or while in care, you can register the death here. Now we'll go back to where we were before to register other things. So we've entered, the result has been entered, and when we come here, we can see that there's a result here already. Now, this person is not HIV positive, but is supposed to be referred for STI management, right? The person has some contact. For hepatitis, you list the household contacts, right? So it has the household contact to list, and also the injection drugs and sexual partner contacts. So we'll list all of this under contact listing. So the first name of contact we have here is Brown James, and the last name is James, the first name is Brown. Then we have the contact phone number is 222-2222, and the sex is, he didn't give us the sex. Let's just go by the name and say male. We'll list another contact. We have John Green, contact phone number 444-4444, and then mail. So these are the household contacts, so there was no need for the address of contact. Now we have injection drugs and sexual partners. So the first name of this is Noah, last name is Oliver, and then the phone number here is, there's no phone number given, but address was given, 45 Park Street. Okay, there's a phone number here, 888-8888, and then the sex is male. Because the scenario say you only has sex with male. So
excuse me 1 minute, please.
Yeah.
For the contact, I realized that the name and last name, everything is starred, meaning that it has to be they has to be put in the first name and the last name.
Yes.
But from my experience, sometimes it's not known.
Yeah, then you put unknown. So it has to be entered. In the event they don't know, you always type unknown for unknown values. Yeah.
Okay. And then you could put the other name, like the nickname also, that they would be known by.
Yes, the other name of contact.
Okay then.
So sometimes people are popularly known by a particular name in an area. You call that name, everybody knows the person. You call their first name, nobody knows who you're talking about. So you want to always ask them for the name. So these other names here doesn't really mean the middle name, but if the person is popularly known by something else that you can really find the person easily, in the event there's no address, then you want that name.
Okay, because I know some persons, they from my experience and when I'm doing contacts, they would tell me that they don't know their correct names, but this is the name that they go by, and it's usually whatever their popular name is.
Yes.
Okay.
Okay. So we put the year, and then the name of this next one is Lucas Benjamin, and his contact number, and then the sex of the contact. Then we have Philip James.
Mildred, question.
Yes.
The system generates the code?
Yes.
Oh, okay. All right.
The system will generate the code, and then we're going to look at how we use this code and record the contact tracing event.
Okay.
Yeah, so Philip James has a phone number 876 4567. Jacob, and the address doesn't exist. And then we have Elijah Logan. The phone number. And then we have Alexander Jackson. So what do you usually prefer they give you? Address, phone number, both, or anything they have?
Anything.
Okay.
Take all you can get.
Okay. So the first name is Mateo Owen, and the phone number. So everybody is male because the scenario says that he only has dealings with male. So we have entered all of the things that we need to enter on the screenings and the VCT side of things. Bruno needs to be referred, and now he's not HIV positive, and so we are referring for other treatments and management, including prevention, STDs, and viral hepatitis. When you want to refer, you need to take note of the type of referral you are doing. So we are going to be referring Bruno for STI management, and then for prevention service at the same time. So the unique ID is and the category of Bruno is adult. So now Bruno has been successfully referred. Is there any IDC nurse on the call that wants to? I think we never had an IDC nurse do this. Nurse Williams, you want to try? Do we have her on the call? Is there anybody from infectious disease nurse that is here?
Are you hearing me?
Yeah, I can hear you now.
Okay, yes, I can try. What do you want me to do? I
So
wasn't
you
here
want,
from the.
Okay, I
What you
wanted you
want
to
me
share your screen and do the care registration of
care registration, initial and care registration and
do an
initial
initial evaluation. Yeah.
Mm-hmm.
So scroll down and look through all the options there. So we have view HIV care referrals if you want to see if there are people in the referrals. View TB care referrals if you want to see the list of TB referrals. And then view other care referrals if you want to see people referred for prevention and other SCI treatments. You can view that list there now. So you
Okay.
identify Bruno's unique ID BUU82M.
So which the other care referral I'm going to, because he's HIV negative. So which one I'm going to? Other care referrals?
So no, scroll down. I wanted you to see the option. So you view other care referrals now to see the option. Yeah. So you see all those people who are referred for other kind of treatment. So we have Bruno's one that we just referred, BUU82M. So it's on the referral list. So when somebody walks into the clinic and says that they were referred, you can check each of the list if the person doesn't know what they were referred for to see the referral that was given to the person and what treatment the person is supposed to be for, or what appointment the person should be given. Now, if it were HIV, you will go to adult, pregnant and adolescent initial evaluation link. If it were to be a pediatric person, you use the pediatric initial and clinical evaluation. And if it was an exposed infant, you will use the HIV exposed infant evaluation. So you go to the other care registration tab there now. So you copy Bruno's unique ID first, the unique ID BUU82M. And then you go to.
Wait, I have to copy.
Okay.
Mm-hmm.
And go to,
and then
go back to care registrations and scroll down. Then keep going down. So you go to other care registration. You enter the unique ID or paste it. And get registration form. And then just put the date and click on register. Okay, perfect. Now Bruno is now really starting to care. So Bruno is no longer on the list of those waiting for registration. If you expand that pages menu, scroll down. So we have two tabs here, two menu here that can be used, or three menus. Go up a little, just one. You can use the prevention control PMTCP. Prevention control is just to start risk reduction plan. If you do it at the clinic, or if you are referring for that to go, and you click on risk reduction to talk with the client. If the client is going to be on PrEP or PEP or whatever the client is going to be on, you click on that to do the referral so the doctor can prescribe those pre-exposure prophylaxis. So you can enter that, the unique ID, or paste it. with a hyphen before the October. After M.
Hyphen?
Yes.
I'm looking for it on my laptop.
Like a minus sign.
Huh?
The minus sign. On the left
Oh,
side.
oh, okay. That?
Yes.
Okay.
And then get client. Okay, now you can now tick the options, enter the date, tick the options that you discuss with the client.
Okay, client will talk about HIV concern risk to partner. So what do? I just take one of these?
Yeah, one multiple option, anything that just make up a case like, okay, client to talk about HIV concerns or risks to partner. You can put that there. And clients plan to discuss HIV testing with partners and get them tested before having sex. You can choose the option, one multiple option. And clients plans to change or stop seeing high-risk sexual partners. You check the options the clients agree to, or type in the box if the client didn't agree to the options. Clients plans to change certain types of sexual partners. Clients will decrease or eliminate alcohol or drug use.
He was a drug user?
Yes. Release injection drugs. And client plans to increase condom use. Yeah, he doesn't use condom in the scenario. In other plan, whatever the client plans, that's the other plan.
Another plan.
The other plan, clients will seek treatment for hepatitis and try to get or talk to partners about his condition.
Did client receive pre-testing consent? If yes, date.
Doing well, Miss Williams, doing well.
Thank you.
So in this scenario, it will be 0 female condom since he doesn't have dealings with females. I mean, the male condom will be the only one accepted, right? So female, you can make it 0. That's all. No, the number of condoms given. The first one is for female condoms, yeah.
Okay. Where do I go after here?
Just click resend.
Okay.
Yeah, okay. Now, after this is done, depending on what you do within the country, if you do any kind of adherence counseling. Now, it depends on what medications. In the event the person will be on pre-exposure prophylaxis, maybe that counseling will be done. If not, just go to pages, scroll down, and go to appointments/patient monitoring. Scroll down. So click on appointments/patient monitoring. And then schedule new clinical management. That's one there, the second option, yeah. And then enter his unique ID. So it will be other clinical management. And then the day of the appointment, let's use today's date.
I put the 17th.
No, today's date, since we're going to
Put in
use
today's date?
Yeah.
Oh, okay. It's a failure.
Okay, the unique ID did not match. So
okay, I have to go back.
So put the unique ID back. So it's BUU
82
M hyphen so old city.
Success. Okay, so that was successful. Hello?
Sorry, my mic was muted. Okay, so perfect. Let's go to pages, scroll down, back to the appointment. Yeah. That, yeah. And then go to create visit, scroll down, and record vital signs. Yeah, that one. So let's assume Bruno is here now. You enter his unique ID and start visit. Now you can record vital signs. So the scenario says that, let's see what it says. Okay, didn't give us anything about his vital signs. So just make up
some?
Yes, make up anything.
Okay, let me just.
Okay. So once that is done, right, you go to pages. So for you, Nurse Williams, your job would have been done now. Perfectly. So the person is now waiting to be seen by the doctor. So this is the process for whichever condition. If it's HIV, instead of using other, you use HIV, the one labeled HIV. So it's like you register into care, you do the initial evaluation, you schedule appointments if you want to do counseling appointment, if you want to do prevention, and then you create an appointment for clinical management, and then record vital signs, and your job is done. Okay, so that's perfect.
Praise God. Thank you.
Yeah,
so how do I get out back of here now?
So you click on stop share on your screen.
Stop share.
Yeah, thank you.
You're welcome, and thank you too.
All right. Any doctor want to try to do the clinical management? We have, who wants to try? Dr. Nisbet, you want to try?
Okay, Mildred. Let me just go back on my computer because
Alright.
I'm on vacation and I'm very distracted here.
Oh, sorry.
I will have to. I'm on my phone, so let me go back.
Alright. Alright, while we wait, let's look at what we are to do for the clinical management. So after Bruno was, I'll share my screen. Okay, so after Bruno was registered into care, he came for clinical management. The physical examination revealed an ulcerated plague on the upper lip, macular rash with 3 crater-like scarred, painless lesion, and so he has cankers on the glands, a non-pituitary hyperkeratotic macro. I will not pronounce these things, just read it. And bilateral stuff. So no ocular or cardiovascular abnormalities were noted. Other symptoms are fever, fatigue, jaundice. We also have the lab evaluation results for Bruno, and we're going to just enter the labs, and then we will look at the management of the hepatitis here. Okay. Bruno has a drug allergy of penicillin and codeine. The diagnosis is secondary syphilis, hepatitis B and C. The treatment is with doxycycline and any other treatments that the doctor decides to add here. Then we have scenarios for other partner screenings and prevention, and the partner therapy for Bruno. So you can practice these ones because we'll just do the clinical management so we can see how other STIs are treated, and then we will look at the central medical store and the pharmacy part before we go. Okay, so I will stop share if Dr. Nisbet is ready. Okay, so you log out and log into the patient management and reporting system. Now we want to go to care clinical management. So you scroll down to clinical management. And then you go other care card. And then the unique ID is BUU.
B?
B, yes. B
B.
for banana. Yeah. U 82M 82M, a hyphen, and OCT. And get care card. So you can now scroll down to see hepatitis registration form. Let's scroll back up to see the tabs. And we have the hepatitis diagnosis, diagnostic data and category, hepatitis risk factors and reason for test. Then you have for treatment of the chlamydia, gonorrhea, and all other STIs with syphilis. And then your treatment monitoring, and then the vital signs if you want to take another. So we can start with the hepatitis registration. So the date of registration is today. The person is not female. The date of delivery is not female. The person is not female. How was this case found? So you can just type in anything. like through routine screening.
Give me a second. Case.
So you can type into the box there. Yeah. So say click on that. So say through clinical presentation. So he came into the clinic because he was having some symptoms. Type. So we have C. Hepatitis C. Confirmation status is genotype 1 HCV. Just put confirmed. Click on the options.
So he didn't have hepatitis B.
Yeah, he had the hepatitis B surface antigen was positive, but was reactive, and then he has the HCV antibody reactive. So we have so you're going to select the B on the option there for the infections with hepatitis virus. The one that he was referred for, the HCV RNA, that was fully confirmed. I think when you do hepatitis B surface antigen, you need another layer of confirmation, right? So that one is done. It was positive, so you fill it in there. Then this is not done according to the scenario. That is not done. HDV RNA not done. Anti-HCV was done and it's positive. HCV RNA was done and is detected positive. HCV core antigen not done and HCV genotype not done. So other exposures, alcohol use disorder. The score according to the scenario for his, let's see what the scenario score says. So just use a 5. So the scenario says that his alcohol use, so put a 5 score.
What did it say about the alcohol use?
The alcohol use disorder identification test score. The score is usually between 1 to 12. So just use 5. Then we have diabetes, no. Wilson disease, no. Autoimmune hepatitis, no. Family cirrhosis, we say yes, according to the scenario. And I think there's a score for that. Click on that, no. Then last option, no. So you save.
Is this one saved? Because I can't see. Let me see.
You click on save. It's not saved yet.
Yeah, but I can't see where save is. Okay.
Okay. Yeah.
Something is blocking it.
Okay. Now it's saved. So we go to the next tab. And now the next tab is the hepatitis diagnosis and diagnostic data category. So dates of confirmation. The laboratory confirmation of case category. Click on the options. So we have unknown or does not meet the first one, the laboratory confirmation of case category. So the case does not meet any of the criteria for newly acquired case. The type of case is new diagnosis. Or so now this, new diagnosis for this because this is the first time he's been diagnosed. But although it doesn't seem like he just got this newly since he has secondary syphilis also on that. Then symptoms, previously selected symptoms, you will find it there. We've not selected anyone. So the symptoms that they have on the scenario here is he has fever, fatigue, jaundice. He also has weakness, nausea, headaches, clay-colored stool, joint stiffness. Nausea. And he has headaches. There's no option for headaches. He has joint stiffness, that's all. So you can select the diagnosis. I think these are all the symptoms. So you can now select the diagnosis.
What is this? This is this I'm not sure. This is for what did we do before for the registration? Was it hepatitis B and C?
Hepatitis. Yeah, B and C. Yeah.
Okay, I'll do that.
Others, they also have syphilis. So you put others there. Specify. And the scenario says secondary syphilis, or what was it? So diagnosis of cirrhosis we have. So you can just save and leave that part until you do the physical exam part. So we need to have, the scenario gave us all of these values and also says this lab test will be requested. And we're going to have these values.
So close out now?
Yeah, you can save now and we can come back to it. And then you want to scroll back down and look at the risk factors for hepatitis. The date. So he has had unprotected sex. He has shared needles. He has injections or infusions. No, he has not had that. He has previous or present incarceration, was what he was in prison. He received a transfusion of blood. He's a male that has sex with male. So I think these are all the risks in the scenario.
Right.
And then reason for test. Symptoms. I think he came based on symptoms. So symptoms of and then others. If there's any other thing known from the scenario. So he came because he was symptomatic. He has some symptoms. So we save.
Trying to follow it. That is all he had? Okay.
Yes.
You have to do this one. Because syphilis.
Yeah, at the top, scroll up.
Yeah.
At the top, we have to view client screening in red. Just go up. To view client screening results, scroll down a little. After the heading, yeah, that one. Or record new screenings, click here. So you want to click there too. Because the scenario says that you are going to ask for liver panel, right? Liver enzyme screenings. So it's when you get that, so let's fill that in and get the results. So BUU 82M-OCT.
Oh, sorry. 82?
Yes, M-OCT. So I'm not even sure if we'll have those screenings there. So you want to go to other screenings. Hold on, let me put in the screenings that we need. Okay, we now have the screenings. So you select, you might want to refresh the page so you can have the screenings on the drop-down menu. Okay, so go to the other screenings tab and enter the date. The type of test now, let's look at, we're doing, let's say AST. Not the liver panel, but let's just write AST. Let's just be specific. Scroll down. And let's use AST. And we have the results already here. The result is the value.
Okay.
Yeah,
I understand.
test,
Okay.
yeah.
Okay. So we can't just choose them like that. We have to put in the result at the same time.
Yeah. So let's say the result is 223.7. 223.7. So the test result now, just scroll down. It should be not applicable on that test result. Not applicable. And then the date. And then we have the ALT. So assuming we have just liver panel as the type of screening, in the result you can just list all the values instead of one at a time. So we have 268.2. The result is not
I think that if you had like the liver panel,
yeah,
and then all the tests in that panel, so once you order the liver panel, everything comes up.
Yeah.
Yeah, that would make it a lot easier.
Okay, so I'll just put the liver panel now.
Because not everybody will know what tests are in a liver panel.
Yeah. Okay, now you'll be able to select liver panel. So we can do it once.
So just do all of them here. So
yeah.
So you say AST and put the value?
Yes, if we just put the values.
Okay.
So AST is 223.7. ALT is 268.2.
2 what?
268.2. The GGT is 255.8. And the total bilirubin is 0.5. So we have values for alkaline phosphatase and the rest. We don't need it for this scenario, we'll just leave it. So just use total bilirubin as 0.5. And then the test result not applicable. Did it. Okay, so this one is easier. So you can go back to pages now. And the menu pages. And then scroll down to clinical management.
Before we go, you said, okay, for instance, you said, what are the choices here? Oh, I see. Okay. So pages and
clinical management. And then go back to the care card, other care card. EUU 82M hyphen OCT and get care card. Yes, I call it BUU 82M hyphen OCT. Okay, so you scroll down. So now you can do you click on that one. So let's fill that in. So previously checked so disease classification related to diagnosis. The client has from the scenario syphilis, chlamydia, chancroid.
And chancroid?
Yes, there's no chlamydia, sorry, just syphilis, hepatitis. Yeah.
Okay.
You've not selected the option, and then in the free field there, you can now write other things. Let me look at the scenario for what the diagnosis was again. Okay, yes, so those are the options. Syphilis, chancroid.
Chancroid?
Yeah. And then on the options there, you can just write hepatitis, the free field. So the physical exam revealed ulcerated plaque on the upper lip, the macular rash with 3 crater-like scarred, painless lesion. So the diagnosis, according to the scenario, is secondary syphilis, right? Now for chlamydia and gonorrhea, there was no diagnosis for that. Scroll down. And then other symptoms. So other symptoms are, according to the scenario, do you have the scenario?
No.
So we have, he has a rash on the glands, non-pituitary.
Try and find it somehow.
Okay. He has fever, fatigue, jaundice. Elevated AST and ALT. PPT.
What are the other symptoms?
Fever, jaundice, fatigue, ulcerated plaque on the upper lip.
Ulcerated. What's this? A chancre?
Yes. And then he has bilateral submandibular lymphadenopathy.
Submandibular
lymphadenopathy. He also has hyperkeratotic macropapular palmar rash, non-pituitary. Non-puritic.
Hyperkeratotic macular rash?
Yes.
Where is that rash?
Palmar rash. Non-pituitary hyperkeratotic macropapular palmar rash. And then he has elevated AST, ALT, GAT.
Those are
liver panel.
Those are test results, not really symptoms.
Yeah, the test was okay.
Well.
Okay, so you save and then you put it under the symptom, the evaluation report part. So you save this one. And then we'll go back to the forms, scroll up. And then we have the hepatitis diagnostic data and category form.
Yeah.
Yes. And then we scroll down. This is where you put all of the diagnoses. Scroll down. So we want to put in the score. Check. Look at the options for compensated. Look. Scroll back up. Is there an option or a free field? Select it.
Wait, for diagnosis of cirrhosis?
Yes. Select the free field. Is it free field? No. Oh yes. The scenario says yes. Then clinical staging. It's A 5 to 6. So yes, clinical staging, yes. Imaging diagnosis. We have lab results, no imaging. What's unknown for imaging diagnosis? Pathological diagnosis, biopsy, no. We used AST score of AST value of. So it's done. The value is 223.7. The ALT was also done. It is 268.2. His platelets is 131. The fibro test score is 0.28. 0.28, the text. Yeah, it says that minimum fibrosis. Put on minimum fibrosis. The report there is minimum fibrosis. The staging of cirrhosis. Select option A, 5 to 6. The encephalopathy score is 1 point none. The asite is absent, 1 point. The bilirubin, select that. It is 0.5. Yeah.
0.5?
Yes. The albumin we have here is not even clear. 3%. Was it 3%? I see it. Albumin is 3%. And then we have the prothrombin time to be less than 4 seconds. That's with a less than sign and then 4 seconds. So diagnosis of hepatocellular carcinoma, no. And then save. So the scenario said that the treatment, he has penicillin and codeine drug allergies. The treatment is doxycycline, 100 milligram orally.
You have to put a date on here, huh?
Treatment, yeah, you put the date, the drug. I don't know if I have doxycycline on the list. Let me add it. So what other treatments would you have given? Let me just add them on the list now.
So this person is allergic?
You said?
Could give ceftriaxone.
We have it there already? Let's see. So what's the name again, you said?
Ceftriaxone. Zone. XON.
Okay.
XON. I think you could also give azithromycin.
Okay. Okay. Any topical medication, no?
No.
Okay. So you can refresh that page again and select the treatment. You'll find those options. So choose other treatment. The scenario says 100 milligram dose. The duration is for 2/52, over 2 weeks. And then on the notes you can put the frequency, the routes, POVID. So you can put the frequency.
Oh.
Okay, then you can add new row to add other treatments.
Add new. Oh. What else we treated? Treating hepatitis?
Yes.
Yeah, he had hepatitis B?
Yeah.
I can't remember if it's 300 milligrams or 200.
300. 300.
Not gonna stop this. What should I put here? Continuous. Duration.
So you put the duration of the particular prescription. So if you give every 3 months, if you give every...
Oh, okay.
So you can put the routes and the frequency there. And then if you have more, it has to delete.
Oh.
So you can add more or save. Okay. So the agreement was that all the pharmacists have said that during all of the evaluation phase of the system that they need a hard copy prescription, right? So once you put it on the system, you write it on the paper, they go to the pharmacy to go get it. Now we can click on treatment monitoring for us to see what is there.
It's the additional treatment for hepatitis C, but we don't have, it's not available to us. So.
Okay. For treatment monitoring, you can select the drug, the dates, and any evaluation there. If maybe you are doing renal function and you see that any medication is causing more problems, you can write it there, the medication, the dates, and your evaluation for that treatment monitoring there. Okay. So, but if not, there will be no point. So you can select the screenings you are doing for treatment monitoring. Maybe let's say bone.
Okay.
Yeah. So if I have renal panel, I don't have that there.
Right. So we would have just done maybe the renal panel for the turn off of there.
Okay. Let me add that. Renal panel.
Even the entire panel, but yes.
So you only need bone and creatinine, or what do you need?
Yeah, bone and creatinine is fine.
Yeah, I think the option is there, lose the option, and then there's renal panel. If you refresh now, you see them. There goes the treatment monitoring. There's bone, there's urea, there's creatinine.
They look like.
And then there's renal panel at the end.
Yeah. Okay, so this is supposed to be creatinine.
Yeah, the spelling is wrong.
Yeah. So I just typed the date in.
The date, yeah.
Sorry.
Just put it.
Just put today's date.
Yes. The date you are sending the person for the screening.
Okay, and that's enough for here, and then when the result comes back, go back to this page and fill it in.
Yeah, when the result comes back, or you want to put the reason for that evaluation if the person is having symptoms that suggest that they're having drug side effects or something. And then when the result comes back, it will be recorded on the other screening parts. So there you can put anything. It's a free field, reason for test, or a whole note about why the screening is requested, or the result of the screening.
Okay. So it's just a routine monitoring, I guess.
So I updated the spelling of creatinine. Okay. All right, so you are done perfectly. And so when we manage other STIs that is not HIV, this is where we use. Now, this form favors pregnant women monitoring more for viral hepatitis. And when you look at the hepatitis registration form, it asks a lot of questions about registering a pregnant woman. We see the different tabs that we have here. Assuming this was an exposed infant form, we will see we'll see different tabs there, more tabs and different monitoring. If this was a pregnant woman's form, it's different. But because it is male, we have limited number of forms. We're not looking for any mother-to-child transmission or anything that an infant is exposed to. So limited form. In tomorrow's own, we're going to look deeply at pediatric exposed infants and the forms for pregnant and others. So for today, thank you, Dr. Nisbet. This is for this management.
Thank you, Adrian.
All right. So before we go for today, we'll look at central medical store and pharmacy. Those are the shortest of all of the functionalities, so it won't take us a lot of time. I don't know if anybody from central medical store is here. So if not, I'll log on. Let me share my screen back. Okay. So I'll see log on as a user assigned the screenings and management role. And once you are assigned a pharmacy permission, you always want to take note of this first tab here to make sure that if in the event you have 2 to 3 pharmacies within the country and some weeks you are assigned to a different pharmacy, you always want to make sure that the first thing you do is to put the name of the correct pharmacy where you are going to be dispensing from on that day. If not, when you dispense and the stock is deducted from the system, it's going to deduct from whatever pharmacy you are assigned to. So if you're in the wrong pharmacy, you'll be deducting wrongly from their stock and not from the place where you are dispensing. Now, anybody with the central medical unit and the pharmacy permission will see central medical store and supplies and pharmacy drop-down menu. The first part before a pharmacist can actually use the system is that the central medical store and supplies have recorded the distribution of medications or whatever they have in stock to the pharmacies. Somebody with the central medical store permissions will be able to see all the list of pharmacies that dispense ARV. The person can also create medication stock, and this is the very important part of it, where the medication stock must be created before a pharmacist can actually enter their stock. So we are going to create stock just for us to know in the event that you don't have central medical unit using the system. You can actually get the list of the medication yourself and enter it for the supervisor so the pharmacist can dispense. So I'll just randomly enter some medications here. And let's say this is So you can have the same medications that have different expiry dates, and you enter them. The form of this drug is, let's say, it's dispersible tablet, and the strength of it, let's say, 60 milligram. The manufacturer, we have, let's say, Cipla. The expiry day, most of the time you don't get a day of expiry, you get the month and the year, and most of the time we just assume that it's the last day of the month. So we'll say 30th day of let's say December 2024. And the batch number, let's say 001-003. The quantity that's to have in stock is, let's say, 500, and the packaging is HDP bottles, and the quantity per pack, so let's say there's 60 tablets in each of the bottle. And we'll add. Then let's add another one. Let's add the 300 milligram tablets of the same medication. The tablet, the strength is 300 milligram. The manufacturer of this, let's say it is Vape Healthcare. The expiry day is January 2025. And let's say the batch number is 01004. The quantity is 1000. The packaging is, let's say, blister film pack. So blister film package, and the quantity in each of those pack is 60. Let's add a different one. The name of the medication is Favirenz. Just write the names. And the form of this is stable, let's see, so FDC tablets. I don't have the option. Let me just put tablets. And the strength of this is 300, 400, 300, 300. The manufacturer of this is, let's see, Macleod. Expiry dates, let's say, is December. Then we have the batch number to be, and the quantity to be 7,000. And the packaging is container, HDPE container. And the quantity per pack is 30. I mean, the amount per container is 30. Then let's add another one. Entry C tabin. The form of this is tablet. The strength is 200 plus 300, I think. The manufacturer of this, let's see, is Gilead Sciences. The expiry day, we'll just use 30th of March 2024, or let's say 30th of November 2024. The batch number, the quantity, 1,000, and then its existing packaging bottles. And it is 30 per pack. Now, assuming you have exactly the same medication with a different expiry date, you enter it over again and post the new expiry date. So you might have 10 cartons of different medication, of the same medications, but they have different expiry dates. You enter all 10 with their different expiry dates. Then let's enter more that we can use to have enough scenario for the pharmacy. So let's say we have amifudin, and the form is tablet, strength is 150 milligram. Let's say this was done by Microlabs Limited. Expiry day is, let's say, 30th day of May 2025. And the batch number will do AH 644. The quantity 2,000. The packaging is, let's say we have PVC. And the quantity per pack 60. And I add this. I'll add one more and then we'll just move on to see the other things. So 16th day of October 2024. And let's add ECG. And this will be, let's see, her sodium salt. This will be a tablet, film-coated tablet. And the strength is 50 milligram. The manufacturer here, let's say, is Milan Laboratories. The expiry day, we use the last day of the month. The month is, let's say, July, and the year 2025. The batch number, let's say, is NDA 210237. Quantity we have is 200. The packaging is the bottle. And the quantity per pack is 30. Okay, so let's stop here. So this is how the central medical stores will enter the stock. It's only medications that the central medical store have entered in their stock that the pharmacies can actually see on the drop-down menu to be able to record the stock that they received. So once you create medication stock, you can view the stock list here to see all that was entered and verify if they're correct. If you have issues with them or anyone is entered wrongly, you can come to edit or recall stock to edit them. If this medication is in stock but later expired, you can now come here to recall to say expired, and you use the red button to remove it from the stock. And the reason is expired. If it's recalled for any reason, defective or harmful, if there's adverse drug reaction, if it's because it's out of stock, you entered it wrongly and it's not in stock, put that there. If it is entry in error, you can put that there to remove it from the list. Okay. Then we have the record distribution. So when you have all of this stock here on the system, it's time to distribute to the different pharmacies, right? You have a drop-down menu of the pharmacy you want to distribute to. You select the pharmacy name. The name of the medication is there, the form, the strength, the quantity in stock, the date it is going to expire, the batch number, the manufacturer, the packaging, the amount per pack. Now I want to see how many you want to supply. The quantity in stock is 2,000. And let's say we want to give out 300, for instance. And you went to distribute this drug and the pharmacist received this drug. Let's say the pharmacist's name is John Doe, for instance. Then click on distribute. So you must have given out, then you come to fill this and fill in who received or who signed for the medication. Now we gave 300 of these out. The quantity in stock is now reduced. So once the quantity in stock becomes 0, then you never see this on the list to enter. So you can use this to make sure you have things in stock, or be able to view what is in stock or what is not there, or how many you have or what is expiring. Now let's also enter for other pharmacies. You can distribute to as many pharmacies, and let's say we're supplying 200 and received by Jane Doe, and you enter them. So once all of these are received by the pharmacies, the person with the pharmacy permission. So before we get there, if you distributed in error or recorded in error, you can come to view distribution, and then here you can delete it and re-enter. Once you delete it, it balances back the quantity in stock, and then you have to re-enter it back. So if there's any error with the distribution recording, you delete and re-enter. You can edit. Once the central medical store is done, then someone with the pharmacy permission will now come here to create stock. You have to enter again what it is that you received, and then let's come here to say we want to enter auto one sample, and I'll let you try. So let's say we received this. We received it in the 20 milligram per mil. The form was liquid. The manufacturer was Viv Healthcare. The expiry date we had there is 30th of November 2024, and the batch number was this. The quantity received was 200, and the packaging was HDP bottle, and the amount we pack was 30, and then we add. So you can enter as many medications that was distributed or you received, their strength, their form, their expiry date. Again, if you have the same medication, different manufacturer, different strength, or different expiry date, you can enter the same as many times as it has one value change. So if a manufacturer is different, you enter it. Again, if the form is different, if it's liquid, it's tablet, you change. If the strength is different, if you have those that are 100 milligram tablets and you have a 200 milligram tablet, you enter twice the stock you have in a different strength. Okay? And once you are done, it is time for you to start. You can view stock. So we only have one in stock. It gives you alerts for when you have those that are low in stock. You have less than 50 in stock, you will see the medication there. If you have the ones out of stock, you will see the list there. And if you have the ones about to expire, you get an alert for anything about to expire, and it will tell you the expiry date. So it gives you everything that has like up to 6 months to expire, so you know which ones are expiring and when it's going to expire there. So you will look at it. It gives you all of those alerts. If you have this, shows you the ones that Central Medical Store has that is about to expire, and then it shows you what you have in your stock that is about to expire. Then it gives you all of the list of everything that is out of stock and everything that is low in stock, as alerts when you have them. So you can view stock. We only have someone in stock that I entered, and then when it's time for you to dispense medication. Yes, Dr. Peters?
Mildred, I have 2 questions.
Okay.
One, persons with that have the role for screening and management of cases. Do they have access to see the pharmacy stock? Not edit or anything, but is it accessible to us in terms of viewing what is in stock and what is not in stock?
Yes, when it comes to the HIV part, I don't think we have viewed that care card yet, where when you get to the care card, you'll be able to see the drop-down menu only shows what the pharmacy has.
Okay. And 2, is there an area for recording like adverse drug reactions?
Yes.
Is that captured? Okay, great. Okay. Yeah. Thank you.
All right, thank you. Okay, so once it's time to dispense, you click on dispense here, and then you will enter the telephone number of the pharmacy, the name of the person who prescribed, the date of prescription, the unique ID of the client, the type of client, if it's HIV care, other care, if the person is on pre-exposure, prophylaxis, or post-exposure, you write it there, the date of birth of the client, the sex, the allergies, the drug allergies of the person, the name of the medication there. So it's going to come from the list of what you have in stock. So we only have one in stock, and so that's the only option we have. The strength of that one in stock, the form, and then the frequency on the prescription, the quantity, the directions for use, you type in there. Let's just fill in one. Let's say we have phone number of pharmacy, the prescriber's name, let's say doctor. The date of prescription is today, the client's unique ID. It was BUU 82M OCT, and the type of client is others. The date of birth for this person, we used January 1st. The year was 1982. The sex was male. Drug allergies, you said codeine, and the drug allergy was codeine and penicillin. And then the frequency of drugs. This was not what was prescribed, but let's just assume that this is it. And let's say the frequency is let's say 1, so 20 milligram per mil. Let's say you say 15 mils, or 1 teaspoon, 1 tablespoon, 15 mil. I'll just write anything 3 times every 8 hours. And then the quantity given, let's say you give 6 bottles, and the direction for use. So you type in the direction, what it's going to be on the prescription label that the client will read. Let's say take, or maybe you have a measuring spoon in it, and you say, let's say fill the spoon until the 15 mil mark, and take same every 8 hours. So anyhow, you are going to write it as a pharmacist. It's what you write here for the direction of use. 8 hours. And if you have refills, you put it there. If you don't have refills, so the date of dispense is today. The day of expiration of the medication, we say it was expiring in November this year. And then the picked up by, let's say Bruno came by himself. We didn't know the last name. And then the remarks and say no refill left or something. Something like that. And then you save the label. Before that, you want to take note of the prescription number. Right? And then you save it. Once you do this, if you print your label, your normal label printer, you can come here to print label and the unique ID of the client. So if you have, like, you've prepared all of the prescription, it was called in, it's something that you prepared, you can now print the label when you fill the whole thing on the system. You print the label and then you attach. So you get all of the information that needs to be there for printing, and your printer will format and print the way you normally have your labels printed there on the medication. Does anyone have a question?
One question, Najol. Suppose you get a stock of, let's say, Abacavir yesterday, and then you get another stock today.
Yeah.
They will add together in the system if they're the same?
No. So when you come to create stock here, right, you have to create the stock. Let it be the date that you received. Then when that stock arrives, and you might have a different manufacturer, a different strength, different form, or different expiry date, you want to fill it in according to what the stock is. If everything is the same, all you need to do is to come and update your stock, but not create a new one. So you come here where you say you view stock here, and then down here you just update the quantity if every value is the same.
Okay. Thanks.
Then once you have dispensed, you've printed label, you want to view transaction history, you can click on that and to show you all of the prescription numbers and all of the what you dispensed throughout the system that is recorded on the system. If you also want to look at the specific client's treatment plan. Now, there are some pharmacists when we're evaluating that have said that sometimes they want to see the doctor's notes before they dispense certain medications. I don't know if it applies to all countries. So you have a link to view the treatment plan for the client. So let's say BUU 82M, and then you can view the care card. Sorry, I put the wrong unique ID. So the treatment plan, I think you can only view for HIV. Clients, you can view for other screenings here. So that's why this is not showing. For all other treatments, you can view that. The treatment plan for HIV is what you can view. If the client was an HIV client, let's look at an HIV client. I don't think we filled in any treatments for this one we used yesterday. KB 95F October. Okay, so we have the symptom review and plan here for yesterday. So you can actually see the treatment plan and the treatments that the prescription yourself if you want to view it, and the client comes in with the prescription. So you can actually view it yourself for the client. When you have the unique ID or something about the prescription is not understandable, you can come to the treatment plan for the client, enter the unique ID, and you'll find the date and the medications that are prescribed. Then you can also view the prescription history for HIV positive client in care. So let's put in the unique ID for yesterday's client. And then when you get prescription history, there's no history of any dispense that was found on the system for this client. So nothing has been dispensed to this person. If you have that and you want to see all of the dispense that have happened over the years for a particular client, this is where you enter the unique ID and you get the history for it here. Is there any question? So you can go to page 203 of the manual that is on your resources to try out the scenario for pharmacy where you enter all of the stock received and try to dispense. And then you can, if you're here tomorrow, you can leave questions and comments. If not, you can send an email if there are queries or comments for pharmacy. Okay, all the pharmacists here, do you have any question?
We got it, Mildred. Thanks.
All right, thank you. So you can try out the scenario. If you have any issues later on, you can send that up. Okay. Does anyone have any question about anything, the practice you did by yourself?
Hello. Mildred, I was just wondering, as the doctor was saying this morning, if you could leave a panel in the number, the type of test requested and so on. I'm just wondering too if you can put serology, which includes HIV, HTLV, all of this, all of those instead of individually. And I am also wondering, like how we have an action to certain areas whereby if you make a mistake, you could always do your correction. As it relates to the creating an account, sometimes you might make a mistake with the sex, the date of birth, or whatever. You realize you made a mistake, but it's like you have to go through somebody to get that correct. I'm wondering if an action can be put by those. Is it possible? Just wondering.
Yeah, it can be changed, but that was the business decision that was made from the beginning because they are like security information, and it might be chaotic to allow anybody just change things and cause the integrity of the data. So if, for instance, it might not happen or apply in the Caribbean yet, but let's say, for instance, a prominent person is on the system and there's election time. You have all of these records and everything, and the person's name happened to be there, or the name is not there, and somebody was paid within the system to change one of the client's name to be the name and all of those security information of one of these people so that they can steal that record, release it, and say that this person has this when it is not the person in fact. So those security information, and there are several types of scenarios where those things can happen to match somebody just for malicious purpose. So because of those kind of security things, you want to go through the supervisor to change those kind of information that are really critical. And if it's a mistake, was entered in error, you definitely have an ID or the real information on why you made that mistake, because it's not be possible for somebody to make a mistake with all the values. I don't know if you understand the rationale with that decision.
Okay. It's just that sometimes if you make a mistake and to get it changed, it takes so long sometimes, so I was just wondering.
Another thing is this: within the program unit, somebody can have the administration permission, or the supervisor can give you a different account with administrative privileges. If, let's say IT is in charge of the whole creation, and IT is not always there. You can have two accounts, your screenings and management and the administration, since you are majorly the one who does most of those things. And so when you have that problem, then you log out from your screenings and management and log into administration and make those changes. That way it is still controlled and there's a log of who made those changes. I don't know if you understand.
Follow you.
Yeah. So you can actually have two accounts on the system. And while we do the final batch of training up until the end of November, if you have in-country issues like that, you want me to update all of your configurations, and so I can do that on your live systems and the accounts before I hand over finally by December. So you can send an email with a request for what you want on your live system that is different for now. And I can only do that between now and December, and after December, it will be between you and your administrator in the country.
Okay.
All right. All right. Anybody else have questions?
Yes, Mildred. What will we be doing tomorrow? What will we be concentrating?
So we're doing pediatric exposed infants, and then we'll be looking at contact tracing.
Okay. Because I know there are lab persons on here, so I'm not sure if they understand their role in uploading results and that kind of thing.
Okay, so maybe we'll add that to tomorrow's own, or you want me to go over that now?
Yeah, probably. I think we have some time, a little time.
Okay, so let's look at the lab. So when you have a lab, an update permission, you are working the lab. The only permission you will have will be updates, and the only option you will see on your live system is screenings, category, mortality updates. You click on this and you look at other /update screenings. You want to enter the unique ID on that lab request form for the client. Let's say the unique ID is AKB89, or let's say 95F. And then you get file. So this gives you all of the different screening tabs where you can update the screening results. If you have these PDF files that you normally print out and give clients, you can instead come here to upload the results. So you can select the type of screening that was done. Let's say it's HIV ELISA, the type used for the screening was ELISA-based test, right? And then the result, you choose a file that you want to upload there, and then you put in the dates. And if you have anything to write here, you want to copy and paste the report, you put it there. If not, the upload is okay, you click on save, and then they'll be able to view the whole image of the file rather than type it. So things like the liver panel and the rest, you mustn't type them as values. You can come here to select the type of screening and then select what was used for the screening, the kind of value or the type of screening done, and then the results, you will upload it from wherever the file is, and then put the dates and click on save. If there are any reports you need to write, let's say this is an X-ray report, for instance, or an ultrasound report. If you upload the image there, you can paste in the summary or the conclusion from the radiology here. So this is just a function of the lab. Get the unique ID of the client, and you have the HIV, TB, syphilis, any other screening that person does. And so now it's left for the doctors to always put the unique ID on the lab request form if the person is an HIV client, even if the screening is not for HIV or TB or syphilis. Any screenings, you have the unique ID that is on the system. Okay. So if there's a drug resistance testing done, if you take sample for it, you can create the record and select everything, and name of the resistance, the mutation, the type of resistance, the genotypic susceptibility, and all the values you get on the result. The ADRO for the different drug resistant testing, and save. So the role of the lab is just straightforward. Is one, you assign the updates permission to the lab, and they will only see the screenings, category, mortality update. They enter the unique ID of the client under other/update screenings, and then they click on that and they enter the unique ID of the client to give them the forms for all of the lab evaluation. They can enter it, they can upload it. Is it clear?
Yes, it's clear.
Yeah, it's good.
Okay. So you can try hands-on. Tomorrow is the last day where we have all the practice and questions. It's good if you try any hands-on, so you can have questions or you need clarification for tomorrow's final walkthrough. We might spend a little more time than today, tomorrow, but I want to give you time to really practice this, because we just have a few people doing the sharing screen and Zoom walkthrough, and we have many more people that might want to try hands-on. So I plan to end the training earlier so you can have your extra time to just sit with the case scenario and just try it out, so you can have questions to ask or any clarification you need or help you need for the final for screenings and management tomorrow. Okay?
Okay.
Okay.
That's fine.
All right. So you can try, if you do antenatal at your clinic, you can try case 5, 6, and 7. If not, You can try 1, 2, 3, 4. If you are doing just prevention and control, adherence counseling, you can also look at the manual that is attached there. There are many case scenarios in the manual. You will see different cases for central medical store, for pharmacy. You can you'll see scenarios from page, so you see scenarios from page 178, I think. So from page 178, 179, you get case scenarios from 179. So you have different case scenarios for screenings, referral, and prevention. You have different cases for the different kind of service that you're going to render. You have, if you go to page 181, we have the pediatric HIV prevention and other STD screening, referral, prevention, and management. We also have that for care registration and management on page 182. If you are an IDC nurse, you can go to page 182 to try the scenarios there. And then we also have 183 to do ANC PMTCT prevention. So you can use the case scenario, or you can go to the manual to see a lot of case scenarios and walk through that you can do or you can practice. It gives you all the values you need, the lab results, and everything you need to look at for the scenarios. Okay?
Okay.
All right. So thank you, everyone. And if there is no further question, I'll see you all tomorrow.
Okay. Thank you.
Okay. Have a good day, everyone.
All right. Bye.